So integrative, functional, traditional, osteopathic, allopathic, that's a lot of scoops in that type of ice cream, right? So a lot of different flavors. What does all that mean? Well, primarily they're divided by licensing. In terms of licensing, it's unlimited or unrestricted license or restricted license. For example, an allopath and an osteopath have the highest level and most open or full scope of care and licensing. We've gone through medical school, residency, postdoctoral training, and we've been working, in a standard medical model. Within that, you might find physicians who are more holistic thinking or more integrative thinking, or you might find that the physicians are very traditional. It varies greatly. A lot of that is driven by the personality, the choices and philosophy of the physician. And as you know, you get 4 physicians in a room, you're going to have 5 opinions, right? Well, then you look at something that might be considered integrative medicine. What's that? Integrative can mean where they come together, different specialties, different types of physicians, different types of care. And that can also mean lifestyle medicine. So you're looking at things such as exercise, activity, food choices, meditation, stress management, that using lifestyle changes, and if we integrate them together, can bring changes within a person for their health care. Also, it could mean that within one building, you have multi-specialties. So they're there and they're together, and that's considered integrative. Then you've got functional medicine. What's that? Well, that's usually where they look at root causes. And from there, you really aren't going to get a diagnosis, but you're going to get underlying reasons why or upstream reasons why symptoms persist or are present or diagnoses are there. When you put that together, functional medicine, it becomes a subset of thinking or philosophy of thinking within somebody who has a full license, such as an osteopath or allopath. So this is really important. There's a lot of functional medicine practitioners. I would say vet them. Vet everybody who you feel might be an influencer to your health. That's me included. So you want to look at my credentials. You want to look at state board actions. You want to look at all the things that makes up really the reputation of that particular physician or provider. And when you look at that, you want to see what's been the responses, what's been the reviews, what are patients saying, what's the feel of the website, what's the feel of what you get when you see them interacting maybe online or in a lecture setting, or even some of the things that any of these folks, myself included, have written or published. A true functional medicine practitioner or provider typically has an additional license to them. So if folks say, hey, I'm a functional medicine practitioner, say, and your licensing is in what? Right? So that's a very good follow-up question to that. The other thing is looking at philosophy, looking at reputation, and looking at who you feel comfortable working with. There's no quick fix, there's no magic cures, but the body has the inherent capacity to heal. So working with that is very, very important. As an osteopath, I can tell you that it's important to understand structure and function. It's important to understand that the body has the inherent capacity to heal, and that when we put that together with good, solid medical care, peer-reviewed information, researched information, standard of care that's here, and that's considered community standard of care. My standard of care or care in your standard is higher. I want to do more for you because I want to listen to what you've got cooking in terms of your symptoms, in terms of the things you say. I want to be able to understand things that are going on with you. I want to be able to review all the testings that you've had done and imaging and the consultations. And often patients come to me to look at things from a bigger perspective or an integrative functional perspective, because maybe something's not fully understood. And despite treatment and other interventions, maybe you're not any better, or maybe a little bit better. Or maybe they said, gosh, there's really nothing more we can do, or, heaven forbid, it's in your head, right? That's just never always true. So integrative, functional, traditional, osteopathic, allopathic, all there, all good care. Look at reputations, get referrals, get word of mouth, and get going and see if you can find someone that you really click with and can work with. Thanks for listening. I hope that's been informative for you. And look me up on the web at drmarylauder.com and follow me on this YouTube channel. Look forward to giving you more information.